All right, let's talk about something that's on a lot of our minds, yellow teeth. We're going to get into all of it, what causes it, how you can stop it from happening, and what you can actually do about it, from simple daily habits all the way to professional treatments. I mean, we've all been there, right? You look in the mirror, maybe you're getting ready for the day, you flash a smile, and wait a second, are my teeth supposed to be this color? It's one of those little things that can really make you feel a bit self-conscious. Okay, so let's get this out of the way first. The good news is, a little bit of yellow doesn't automatically mean something's wrong. It's not necessarily a red flag for your dental health. But, and this is a big but, you don't want to just ignore it either. It could be a sign of something else, like plaque building up or your enamel getting a bit thin. So, if we're going to figure out how to prevent this, or even treat it, we've got to start at the beginning. We need to really understand what's causing our teeth to turn yellow in the first place. It really all boils down to some basic tooth anatomy. Think about it like this. Your tooth has this hard, kind of see-through outer layer. That's the enamel. Right underneath that, there's another layer called dentin, and here's the kicker. Dentin is naturally yellowish. So, the color you see when you look at your smile, it's actually a mix of both of those layers. Okay, so if we all have this yellowish dentin, why do some people's teeth look way more yellow than others? Let's dive into the main culprits, the things that are really behind that staining and discoloration.
And this right here is a really important distinction to make. The causes basically fall into two big categories. On one side, you've got the stuff you can actually control, like your diet or how well you brush. On the other side, you've got things you just can't control, like your age or your genetics. Knowing the difference here is honestly half the battle.
All right, let's start with the things we can do something about. We all know the big ones, right? Coffee, tea, red wine, they're famous for staining. That's because they have these things called tannins. They're basically natural dyes that just love to cling to your tooth enamel. But it's not just them. Think about other colorful foods, dark sodas, berries, even tomato sauce. They can all leave their mark over time. Now, let's talk about the stuff that's, well, out of our hands. As we get older, our enamel just naturally gets thinner. It's a fact of life. And when that happens, more of that yellow dentin starts to peek through. Your genes also play a huge part here. Some of us are just born with thinner enamel from the get-go. And you know, even some medications or getting too much fluoride when you were a kid can affect your tooth color for good. Okay, so we know what causes it. Now for the most important part. What can we actually do about it? This brings us to the prevention playbook. These are simple but super powerful habits you can build right into your everyday life. And this just shows you how simple prevention can be. Seriously, this isn't about some massive life-changing overhaul. It's about being consistent with the basics. You know? Brushing, flossing, and little tricks like just swishing some water around your mouth after your morning coffee. That makes a huge difference. Oh, and eating crunchy stuff like apples, they're like a natural toothbrush. And of course, we gotta say it, quitting tobacco is maybe the single biggest win for your teeth and, you know, your entire body. Now, I know what you might be thinking. What about at-home remedies like baking soda? A lot of people swear by it. And the source here gives a really clear warning. Yes, it can help a little with surface stains, but, and listen up here, it's abrasive. If you overdo it, you can actually wear down your enamel, which is the exact opposite of what you want to do. So the main takeaway? Moderation is everything.
So, what if prevention isn't quite cutting it and you want to tackle stains that are already there? Let's look at the whole spectrum of whitening options, from stuff you can grab at the drugstore all the way to what your dentist can do for you.
This chart is a perfect guide. So on the first level, you've got your over-the-counter stuff. You know, whitening strips, gels. These are best for pretty mild surface-level stains. If you're looking for faster, more dramatic results for deeper stains, then you're stepping up to professional treatments, like in-office bleaching. And finally, for those really deep, stubborn stains that just won't budge, there are cosmetic options like veneers that can give you a complete, long-lasting fix. And this is the million-dollar question, isn't it? If I'm going to invest in professional whitening, how long is it actually going to last? Well, you're typically looking at about 1 to 3 years. But, and this is super important to remember, it really depends on your lifestyle. If you go right back to drinking coffee every single day, well, those results are going to fade a whole lot faster. So, after looking at all these different paths, from tiny habit changes to big professional procedures, it really all boils down to this, doesn't it? What's the right choice for your smile? And that really brings us to the most important point of all. No matter what, being consistent with good, simple habits is always your best defense. But if you're thinking about any kind of whitening treatment, from a box of strips to something at the dentist's office, the smartest thing you can possibly do is talk to your dentist first. They're the ones who can help you find the absolute safest and most effective way to get that brighter, healthier smile you're looking for. Thanks so much for joining me.